Thanks for joining us. Xavier Becerrato, Secretary of Health and Human Services. Pleased to be joined by HUD Secretary Marcia Fudge, a dear friend, longtime colleague. And we're here on what I hope is not just the first partnership together, but one of many partnerships I hope we talk about where we try to combine the resources of our agencies in the federal government to try to work closer with Americans, whether it's on housing insecurity or whether it's on health insecurity. We have a role that we can play, and if we do it together, I think we both agree that we can be stronger. And it certainly helps build on President Biden's message of building back stronger, building back better as we come out of COVID and get this economy going. Because I think we'll all agree that our economy cannot be healthy if the health of Americans is not there as well. And so we need to work hard to make sure they're healthy and that they're housed. And that's one of the reasons we're here with the Community of Hope. And I'd like to make sure we acknowledge Kelly Mcshane, who is the CEO, and all of her team here at City of Hope for the phenomenal work they do. I will make one quick comment because I think too often it's neglected. Anyone, rich or poor, young or old, would enjoy walking through the doors of this place because you feel like you're being treated with dignity and with respect, and you're being treated by professionals who care. And one of the first things we have to do, especially with these issues of, for example, vaccine hesitancy, is meet people where they are. Make them feel like we care enough to go to them. If someone's going to have to go see a doctor, maybe a dentist, find out about long-term housing, it sure helps when you can walk into a place like this and feel like, wow, if this is what this place looks like, they must be offering pretty good services and care. And so I have to tip my hat to Kelly Mcshane and her team for what they do here at Community of Hope to give people real hope, but more than that, give them the respect and dignity they deserve. We're here principally because President Biden has made it clear through the American Rescue Plan, now the proposed American Jobs Plan, and certainly for Secretary Fudge and I, the American Family Plan, that we're able to provide Americans with what they need to move beyond COVID, to get ready to go back to doing things right. And one of those things is making sure that everyone has a good foundation from which to work. Hard to have a good foundation if you don't have a place to sleep. Hard to have a good foundation if you can't depend on your health. And so we're here to say that through the initiative of President Biden and Vice President Harris, we have an opportunity to invest in all Americans. And the American Family Plan, from the perspective of Health and Human Services, is phenomenal when it comes to investing in Americans. The fact that we're going to talk about being able to provide so many more resources and support for our children, from early education before kindergarten to even after high school into community college, 2 years of tuition-free community college. Beyond that, healthcare, making sure that all those families who are paying for their health plans under the Affordable Care Act don't find themselves falling off of a cliff because they don't have enough support through the tax credits to continue to keep their plan in place. The President wants to make permanent that tax credit that makes a lot of middle-class American families eligible to keep that insurance that they have for their families. We know what happens when you don't have that health security. COVID taught us very well, and there are too many communities that have shown that they have not had the reach of our government, our investments to get to them. And so I'll finally close by saying this. Zip codes tell you a lot of things. They certainly tell you more or less where you live. I don't believe zip codes were ever meant to tell you what the status of your health would be. But in America, too often, your zip code tells more than just where you live. It tells a story of your health. And I believe Secretary Marcia Fudge and I are here on behalf of President Biden and Vice President Harris to say that regardless of what your zip code is, we want to make sure that you are housed and you are healthy. And this partnership that Secretary Fudge and I have created and are now in the process of moving forward, is now memorialized in this letter that we have both issued, talking about how we need to invest in America. The American Families Plan, the American Jobs Plan, and certainly the American Rescue Plan give us that opportunity to tell Americans, we're here for you, we're going to go where you are, and we're going to invest in you because you are our future. With that, let me turn it over to the Secretary of Housing and Urban Development, Marcia Fudge.
Thank you very, very much, Mr. Secretary. It's a pleasure. It's a pleasure to be in this outstanding place. You know, we know that health centers, community health centers, are especially important to the communities that I happen to represent. Those who are low-income public housing, those who are homeless or at the risk of becoming homeless. And this is a model that I hope that we can use in other places, because there are going to be lots of resources coming in the very near future, some already out from the American Rescue Plan. So I want to be sure that we look at this model, because I think it is exceptional. And I also want to say that it is a real pleasure for me to work with the Secretary of HHS. You know, we have looked at government for a very long time in silos. There are no more silos in the Biden-Harris administration. It is an all-of-agency effort to make sure that we get people vaccinated, that we take care of people who are sick, that we make sure our children are educated. And so I am just so pleased to be in the President's cabinet, as well as to talk just a bit about the American Rescue Plan. You know, I look at all of the things you're doing. I must have heard the word telework 10 times this morning. You can't telework if you don't have the internet or broadband. I think that the jobs plan has created roads and bridges for the future of education, of healthcare, of all of the things that we do in this country to make us the nation that all of us hope that we will be. So it is actually gratifying to see that these kinds of things are happening in the city of Washington, D.C. I've had an opportunity to speak with your mayor on a number of occasions, and to see the visionary work that is going on here just does my heart good. I happen to come from a community where there are lots of community health centers, and we know that they are trusted partners in communities. So we're hopeful that by using community health centers to get into our public housing and to get people the vaccine right where they live is something that is going to be helpful. And lastly, I would say that this is probably our last best opportunity to make a difference in the lives of so many people. We have the resources, and we have a president and vice president who have the desire and the will to make it happen. So I want to thank this team here, because I don't know that we'll have this chance again, where Congress will pass a bill, a COVID bill in December, come back and pass a rescue plan, and hopefully pass a jobs plan, because that is what it's going to take to make a difference. That's what it's going to take to make public housing safe and decent. That's what it's going to take to get people off the streets. Any day in 2020 in this country, more than 580,000 people were homeless in this nation, in the greatest nation in the world. So I am looking forward to our work together. And again, I thank you all so much for having me today.
Kelly, you're going to say something?
Thank you. Good morning. I'm Kelly Sweeney Mcshane. I'm the CEO at Community of Hope, and it's been my great pleasure to welcome Secretary Becerrato and Secretary Fudge here to Community of Hope today, and yourself as well. So Community of Hope's mission is to improve health and to end family homelessness, to make Washington, D.C. more equitable. We are unique in that we are a federally qualified community health center, and we're also one of the larger providers of services for families experiencing homelessness in the District of Columbia. We know firsthand that health and housing stability are deeply interconnected in the lives of the families and the patients that we work with. Hence, this is a perfect place to announce a partnership between HUD and HHS to expand access to COVID vaccines. As a community health center, Community of Hope was quick to start offering COVID vaccines at the end of December of 2020, and we provided over 5,000 vaccines since that time and continue to do it every day, including today. As Secretary Becerra said around zip codes, in Washington, D.C., COVID has only highlighted the inequities that have already existed within our city. Today, we are here in Ward 8, a ward that is predominantly African American, and a community where nearly 30% of COVID deaths occurred. That's 4 times higher than deaths in the wealthier Ward 3, which is also a higher percentage of white residents. And now Ward 8 only has half the number of people vaccinated as Ward 3. So Community of Hope is committed to working to address this inequity through providing access to vaccines in Ward 8, as well as helping people feel comfortable about getting the vaccine. In early January, we quickly moved to target our own patients, have done a lot of outreach, and now have walk-in COVID vaccines available here every day. And we are starting to look at other ways we can partner, including with public housing as a way to get out and into the community, to provide more pop-ups and in combination with education about the benefits of vaccine. So this joint HUD-HHS initiative will be critical for Community of Hope to better support our neighbors living in public housing and help them receive the vaccine. I'm excited about next steps and look forward to working in collaboration with the 2 agencies as well as with community-based organizations in order to ensure that everyone is protected against COVID. Thank you.
And with that, I think we're ready to take some questions. Yes. And let us know who you're directing to. And we can keep the questions to the subject matter of the press conference.
Yeah, the Secretary Becerrato. Yeah, I'd like to ask you, messaging has always been an important part of the COVID response. But it seems like it's even more critical now because there's adequate supply, more than adequate supply of vaccine. So I'd like to ask you, what do you think are the most difficult obstacles to getting your message across? What is it that makes it harder for you to connect with people? What groups are you most concerned about? And what happens if we don't get to 70% by July 4th?
And by the way, if I could ask that you also give name and affiliation, that helps all of us. So can I mention names of the 2 clients, or should we not mention their names?
I think not names.
Okay. So we heard from a couple of patients who are patients here at the Community of Hope, and they spoke to that issue, that here you have this phenomenal facility, yet there still is some reluctance on the part of many. Mostly what we heard, and Secretary Fudge touched on this, oftentimes the technology doesn't reach them. If access to vaccine information and how to get on the website to schedule your appointment is done by the internet, for a lot of folks, including here in Ward 8, for example, it may be tough. You may not have that access to that technology. You may not have access to all the information coming forward. There's also reluctance on some occasions because the people you respect that you turn to don't necessarily aren't necessarily the faces you see on TV speaking to you about the importance of the vaccine. For many communities, unfortunately, there's been a history where these types of programs, whether it's a vaccination program or some of these testing programs, have not necessarily been done in the interest or for the safety and well-being of the community being tested. So there are a lot of things there that go on, but I can tell you this. We're not going to wait for folks to express those apprehensions. We're going to go to where they are. That's why we're here at Community of Hope, because we want folks to know that we want to reach you. And with President Biden and Vice President Harris making equity such an important pillar in their platform, we want to make sure it's clear that communities of color, low-income communities, immigrant communities who have often been left out will not be left out by this government and this administration. So we're going to reach out to them, and this joint partnership that HUD and HHS are announcing today when it comes to vaccination, working with great facilities like Community Hope, make it clear we're not going to wait, and we're going to reach out to you.
But how do you reach people who may have, and the Secretary of Fudge as well, for both of you really?
Can I just respond to the question you just asked him? I just want to say this, that there are lots of reasons. Certainly, we have a nation that over the last 4 years has decided that they don't trust government. So we have people who distrust government. We have cultural sensitivities. We have access, just because it is available doesn't mean that people have access. So we need to make sure that they have the transportation. But what our goal is to meet people where we find them, to go to places where people congregate, whether it be in public housing authorities, whether it be in community centers. We're trying to take the vaccine to the people. We believe that is going to be helpful. And the other thing is we are looking at making sure that people have trusted voices. I think it is past time that this country understands that its government does care about them. And so I think that we have some work to do in terms of educating people. We've gotten the low-hanging fruit, the people who really want the vaccine. Now we have to go and do the next step and try to explain to the rest of the country why it is important to get it, so that we can protect each other, to be a community again, a neighborhood again, a family again. So we have some work to do too.
You just, if I just may follow up real quick.
Let's do this, because I know that we're going to have to break in a second. Let's go to those who have questions, and we'll come back to you.
Okay, thank you.
Yes, right over here, give us your name, we'll go down the line.
Shira Stein, Bloomberg Law. Mr. Secretary, this pandemic has highlighted the inequities in our system. You have talked about this at length over your confirmation process and now that you're Secretary, but there are no real easy solutions to solving social determinants of health and health inequities. What policies are you and your team discussing? What sorts of things like this partnership today would you like to do moving forward to work on health inequity?
Exactly this type of partnership where it's not just a matter of getting the vaccine in an arm and trying to help improve people's health. It's working where the people are. And sometimes we have to go to the public housing complexes. Sometimes we have to go to where we will find people more readily. And so we're not going to wait. We're going to partner up not just with a facility like Community of Hope, but as Secretary Fudge mentioned, people who are respected in the community. It could be a faith leader. It could be your doctor. It could be your high school athletic coach. Whoever it is, we're going to try to use them to help us reach those communities. Again, we had one of our speakers mention, it was Ms. Langford, I think, who mentioned, one of the nurses, the lead nurse practitioner here, who mentioned that, or was it Monique? Someone mentioned that there's a group of men who congregate, not just in this community, who are in their 70s or so, many of whom are reluctant to get the vaccine. We got to go to them. And if you got this great center here that yet they're not coming, we got to figure out why. And so we have to overcome those barriers that exist because there's a great amount of work to be done. But more importantly, as Secretary Fudge said so well, we got to show folks they can have faith in not just people but in their government. And we're here to try to restore that and show them by example. Let's go down the line real quickly.
Yeah, I wanted to follow up on that real quick, on the urgency that you're kind of talking about on these equity efforts. So, I mean, the administration's been talking.
Name and affiliation.
Oh, I'm sorry. This is Adam Cankren with Politico. So the administration's been talking, I think, since the transition about centering equity, especially when it comes to the pandemic response. But at the same time, I mean, we're seeing vaccination rates for Black and Latino populations in particular lagging. It is May 5th. We're only seeing this partnership announced now. Has the administration done enough on this front up until now? I mean, why is this only kind of beginning now?
And I know Secretary Fudge is going to want to comment on this one as well. Yeah, Marcia, I don't know how long it's been since your confirmation, but I passed my month date just recently. And we both served in Congress together. Let me tell you, what we saw President Biden accomplish in 100 days, not 100 million shots in arms, 200 million shots in arms. Not just a commitment to help America get back at it, but an American Rescue Plan that put a bigger investment in doing that for Americans than I think either one of us had ever seen. Everyone talks the talk. Everyone makes the promises when they're campaigning. I will tell you, and I've known President Biden, like Secretary Fudge, for a long time. But to watch President Biden get things done, let me tell you, I think it gives us the boost to know that we can try to get things done. And so, yeah, there's a lot to do. Secretary Fudge and I can tell you, there are a whole bunch of Americans out there who've always been missed, who live in those corners that have always been neglected. We're going to go there. And the fact that President Biden chose Marcia Fudge and Xavier Becerra to lead two of these big departments, I think is another signal that equity is not just talk. We will walk it. Let me ask Secretary Fudge.
Let me say that there have been some things that have prevented us from doing it. You know, normally, I live in a Black community. Most of the time when I want to find people, I go to the church. They're not in church because of COVID. I go to the community center. The community centers are closed. I go to the playgrounds. Just now are we starting to say to people, it's okay, it's safe to be outside. I go to festivals and to the park. None of those things have been available to us. So we have to find a way to look to get to them in a different way. And so that's why we're here today, because we're excited about the possibility and the opportunity to go to places where we know we can find people who have historically not been involved in systems the way that people in the wards you were talking about are. It's just difficult because of the COVID itself. It's harder to get to people. A lot of people we're talking about have no transportation. A lot of people we're talking about are not going to stay on a phone all day waiting to try to get an appointment. A lot of them cannot navigate the internet or the social media things that they need to do to get appointments. And so we know that that's a problem. And so now we're trying to fix it. Has it taken us too long? Probably. But I would still say that this administration is even today vaccinating more than 2 million people per day. So it's not as if we're not doing a good job. We just need to do a better one.
Do you expect that demographic gap to close as a result of this kind of increased focus?
Oh, absolutely. I'm confident about it.
Just 1, 2, and then I think if we have time, we'll go back to follow-up.
Hi, I'm Selena Simmons-Duffin from NPR. I'm just wondering if either or both of you could talk a little bit about the details of this partnership, what it entails. I know here in D.C., DC Health went to public housing for seniors in February and did outreach clinics right there. And I think that was pretty successful. If there are examples that like concrete examples of how this partnership could work. And also, I'm interested to know if there's any information about vaccination rates among people who live in public housing.
I know that we do have it. I don't have it with me, but I can certainly get it to you. We have seen this work. As a matter of fact, I'm headed to New Jersey tomorrow to do 4 different sites. Some of those sites we know that have been successful because we have taken the vaccine to the people. Many people think that, well, they just don't want the shot, and that is not necessarily true. When we talk about making sure that there is access, and that's a word I've heard a couple of times today, sometimes you really do have to go to the people. And so we've been getting these shots out so quickly, people have been coming to us. We know it can work. I talk to tenants associations, I talk to people that run public housing, I talk to people who run multifamily housing. We know if we can get to the people, they will take the shot. Most of them. You're always going to have people who are hesitant. I mean, I come from a culture where we still talk about the Tuskegee experiment. And I had to explain just the other day, it wasn't the vaccine that we should be afraid of. They injected our people with the disease and did not give them the vaccine to save them. And so I think that people, once they understand how important the vaccine is, I take every shot that comes out. I take the flu shot. I take everything. And I think that my taking the shot and showing my constituents at the time that I was a member of Congress made a lot of people take the shot that might not have. So it's all about doing it right, as we talked about. Trusted people, pastors, athletic coaches, community leaders, just the person that maybe runs your block club, your PTA person. We know how to reach them, and so that's our job now, is to make sure we do.
And I will associate myself with that answer that the Secretary just gave, and I'll only add this. We have now, in writing, directed our agencies to work together to reach individuals in public housing. And so it's not just that we want to do it, we're directing our people now to work together to get that done. And so that's not just a promise. It goes beyond the commitment. It goes to actual action where we require our agencies to work together to get that done, because we have to. And so I agree with everything Secretary Fudge said, and now we put it in writing so it's clear to all of our folks. Work together. Last question here, and then if I don't know if you'll have time, Secretary, for a follow-up, but we'll see.
Do these last
Okay.
Great. My question is for Secretary Fudge. My name is Chelsea Souza. I'm a reporter with U.S. News. I wanted to ask you about something you touched upon, actually both of you, which is chronic homelessness. As I'm sure you know, the HUD PIT count from 2019 saw an increase in chronic homelessness. In D.C., which just put out its numbers from this year, while there was a decrease in overall homelessness, which they attributed to federal action, there was an uptick in chronic homelessness, particularly among families. How does this partnership hope to address that as well?
Well, there are two things that we're looking at. If you recall, in the end of last year and with the American Rescue Plan that the President provided to Congress, there's $5 billion in emergency housing vouchers that we know are directly tied to persons who are homeless or those who are at risk of becoming homeless. We also have $5 billion in a program that will allow cities and communities to house people. I mean, there are Secretary Becerrato is from Los Angeles, where they have been housing them in hotels and things like that. They now have the resources to purchase them. In D.C., your mayor wants to look to build new housing. And I think it's outstanding to be able to have the resources to start communities so that we can get people off the street. So there are resources. And then thirdly, let me say that the resources that we put in to stop evictions, and to stop, and the moratorium on foreclosures on homes. We know that we have put enough money in the system through the rescue plan that people should come out of this June 30th at least current. And so that in itself is going to allow us, hopefully, to keep people in their homes, as well as those people who actually have homes through FHA or through the federal government. We are working with home buyers. So I think that we've not only given resources to make a dent right now in those who are homeless, but to keep people from becoming homeless as well.
Just a quick follow-up. Does that mean you guys are not planning to extend the ban past June 30th?
As of this time, I'm not aware that we are.
Okay, thank you.
Quick follow-up then.
Hi. Ricardo Alonso Zaldivar with AP. And I just wanted to get back, here's the mic. I just wanted to get back to the issue that Secretary Fudge brought up, and Secretary Becerra, if you could join in too, distrust of government. And you have distrust of government for different reasons among different groups of people. So the message that you take to one community may not work in another community because they may not be happy to see you at all. That's right. So tell us a little bit about how you're going to deal with that.
Well, it's really just as I said. I think that until we have engaged people in a conversation, they're going to have distrust. But I also think you show them by the work you do. We have already vaccinated more than 200 million people, at least with one shot. The president has said that he wants to make sure that 70% of all eligible Americans are vaccinated by July 4th. You show them. You can't just keep talking to people with no action. It is about action, and that is why we're here today, and that is why we have this agreement today. You have to show people. I don't know anyone who will just look at television and say, oh, they're just so wonderful. No, it's not how it works. We have to do the work, and that's what we're doing now. We're doing the work.
I buy that. Well, thank you all very much. Appreciate it. Stay safe.